Hey, in this video, I'd like to talk about the knee joint. Now, when you first look at the knee, the skeleton, the knee is the most improbable joint. We have to weight bear on it while we walk. And if we just look at the skeletal components, that just does not look right. That looks like something that should not be happening. But the one thing that we're not seeing here is all the soft tissue that makes this a workable, functional joint. So let's start and remind ourselves that when we're looking at the knee joint, we are looking at the femur, and of course I've done a video on the femur. We looked at the head, the neck of the femur, the shaft, and down here the condyles. And you notice we have a space between the condyles, and those are going to be important soon. And of course that sits on top of this bone, which is the tibia. This is the superior aspect, this is the front of the tibia, posterior aspect, and of course the inferior aspect. And when you look at the top of the tibia, you see that it's sort of a big platform, but it does have some indentations. Now, let's start to put them together and see. So there's the condyles, and the condyles sit within those indentations. Now, that does not look stable. So let's take some time and start to look at the model that's going to show some of the major things that are going to hold it together. Because if you think about it, with a joint like this, I have to make sure that it doesn't slide forward, right? That the femur can't slide off the front, or it can't slide off the back, and it can't slide off to the side either. So I'm going to have to stabilize it in many ways, and I'm going to use soft tissue to do that. And then I'm going to wrap the whole thing in other soft tissue, almost like a compression stocking to hold it all together. So let's switch over and let's look at the model. So here's a model, and it's starting to show some of the soft tissue that we're looking at. So once again, we have the femur, and down here we have the tibia, and here's the fibula. Now, you notice the fibula isn't part of the joint, but we're going to have to talk about the fibula because there's a little piece of tissue that comes up here. So this is the anterior surface, and of course behind here is the patella, and I'll do another video just on the patella at some point. Now, you notice that there's soft tissue up here, and this is the tendon for one of the main muscles in the thigh, and this is the rectus femoris, so the tendon for the rectus femoris. And coming down here, heading down from the patella, is the patellar tendon. Now, let's try and look inside here. It's going to be a little tough. I'm going to try and pull stuff out of the way. Now, you notice that this soft tissue has formed a structure, and this is cartilaginous type tissue, and these are the menisci, the meniscus. And you see that they've sort of have a raised area here, and that really allows the condyles to sit within there. And many people end up with injuries to their menisci, meniscal tears. And you can see, in many ways, I kind of think of them most like a little egg cup that the condyles sit within. Now that helps to really stabilize, because remember, the knee joint is a type of hinge joint. It's a modified hinge. What I mean by modified hinge, yeah, it does hinge motion, but it has a slight rotation, which helps to lock it in place. It's very slight and almost imperceptible. So we have the tissue at the front that's helping to support it. We have the menisci that are acting as sort of little guides to hold those condyles in place. And now we got to start thinking about how we stabilize it side to side and front to back. Let's start by the side to side. You see that we have a ligament that runs up here. Now, let's get some orientation here. This is lateral, this is medial. So this is known as a collateral ligament. That's a collateral ligament, and that's a collateral ligament. So each one of these has two names, unfortunately. I could call this the lateral, collateral ligament, or because it comes off the fibula, it could be the fibular collateral. Over on here, this is the medial side. So I could call this the medial collateral ligament, or because it comes off the tibia collateral ligament. Now let's look at what's going to keep the joint from moving forward or backwards. And that gets us into the cruciates. These are two ligaments, one that runs from the front to the back and one that runs from the back to the front. And they cross each other. That's where it gets the name cruciate. They cross. So they're a bit tough to see, so I'm going to try and open this up a bit. Now, if you look in there, okay, this is the anterior surface. You can see there's a ligament that runs anterior through the joint to the posterior aspect. That is the anterior cruciate ligament, and I'll try and really zoom in there so you can see the anterior cruciate. Now, the anterior cruciate, of course, what it does is, because it runs from front to back, it prevents the tibia from sliding forward, or you may think of it, it prevents the femur from sliding backwards. And this is a ligament that's often damaged, and one way they assess it is basically they stabilize a knee joint and they see if there's any movement to the front. And if there is, that may suggest that there is damage to the anterior cruciate. Now let's turn around, and then back here we have another ligament that's attached here and heads that way, and that is the posterior cruciate. So those are some of the main ligaments, and let's just quickly review, is that when it comes to the knee joint, I have the menisci, the individual meniscus, the menisci that hold the condyles, so they will move in the proper orientation and give them some stability. And then I have the collateral ligaments. I have a lateral collateral ligament, remember it has a second name, and I have a medial collateral ligament, and that helps to prevent side-to-side motion. Now, by the way, these can be damaged if someone has a sharp blow, especially this bone is very long and acts as a lever, and you can get damage to these, so sometimes they do get damaged. And then to prevent front to back, anterior to posterior movement in this joint, I have the cruciate ligaments. And once again, inside, the anterior cruciate runs from front through the joint to the back, and the posterior is attached at the back and moves anteriorly, and they help to basically stabilize it. Now, that being said, just these really stabilize this joint, but there is more that holds it in place. And once we get into the videos that deal with muscle, we'll see that there's many muscles up here, and they send down a lot of tissue, other ligaments and things like that. And in addition, there is sort of a group of tissue layers that help hold this in place. This is a synovial joint, so every synovial joint also has its own tissue. So you can see there's many, many layers that will help to stabilize the joint, but at least those are some of the basic ones to look at and start to appreciate. And I'll just spin it around so you can get a really good view of it. And thanks for watching. And if you get a chance, hey, hit the subscribe button. If you have any questions, let me know. And also, if you have any parts, any joints or any muscles or anything in the world of anatomy you want me to make a video on, let me know. I'll put it on my to-do list. Thanks for watching. Take care.